Dr. Piskin, there is such a thing like minimum invasive surgery, usually reserved for surgeons, operating on the liver or God only knows what. There's apparently also such a thing called minimum invasive dentistry. Tell us about it.
Well, it's just the same concept. It's basically getting the disease out, but doing it so conservatively as opposed to the way it used to be done. So we have things where if you have a little cavity in one little tiny spot on a tooth years ago, in many offices, maybe even today, it's still being done, they would drill a large hole in the tooth and shove a big silver filling in there. Well, that's not what I do, and I haven't done that for a while. We have other choices. If you can just take that away and then the rest of the tooth, seal it, and use a composite in the little tiny area where the cavity was just starting, we have preserved all that tooth structure. It's done very easily. It looks great. And more importantly is you don't even need to be anesthetized. No Novocaine, no needles, because you've caught it early. And we also have a special laser that actually can detect cavities even before we can even see it on an x-ray. And many times can detect it even before you use your instrument. The dentist, you'd go and they'd stick that pointy thing in the tooth and they try to feel it until they go in, out. Well, that doesn't have to happen anymore. We use this laser called a Diagnodent, and it gives you certain readings, and the higher the reading to a certain level tells you that there's something going on, and you can catch it so early so you can address it and do this minimally invasive dentistry and sealers and preserve all the tooth structure, and we do it for kids. The first molars coming around age 6, and even adults. It's a great service. I love doing these things. Patients are so happy. They're not numb when they're leaving. There's no injections, and they've preserved all of that healthy tooth structure. It's just wonderful what we can do today. So that's called minimally invasive dentistry.
Are there any other example, like in periodontal surgery with laser, where you don't really, in the old days, it was like you cut in and you take out all that debris. Now it seems to be more like you're building on it.
God bless you.
That was a good sneeze. That was a good sneeze. So it looks like
lasers,
that it is.
Of course, lasers are used. Lasers are a very big part of my practice, and there's all different types of lasers, and lasers are used for treating gum disease. We use it for trimming the gum around. We use it for helping with surgeries. But the healing effect of lasers is amazing because we're not cutting through this stuff. It's microscopic cells it's very, very minute. And the healing aspect of using lasers, whether it be on teeth or on gums or in periodontal disease or in using it for biopsies where we don't have to cut and use stitches. You can do a biopsy very easily with a laser, and it heals up so quickly. So just like in medicine, the guys in medicine or the women in medicine that are using lasers, whether it be for the eyes, whether it be for open heart surgery, we use it today as well in dentistry in all aspects. It's a great service, and here in my practice, we do use a lot of lasers.
So basically, the whole business of dentistry is becoming less bloody.
Absolutely. Less bloody, less disease, less use of the need for injections, and patients that are very, very happy that they come without all the anxiety associated with the old dentistry, where it was uncomfortable and cumbersome and unsightly and painful. That's all gone. Doesn't have to be like that anymore.
And let me ask you, is this super, super widespread, this type of treatment, meaning does every dentist by now do that, or is it still kind of in the coming and not everybody is yet trained, prepared, or has the equipment? Because I assume that some of that equipment costs a pretty penny. So what's the deal on that?
Well, lasers has been around for a while. I've been using it for quite some time, good 20 years. It is becoming more popular today. There's all different types of lasers. There's lasers that cost $60,000 to $70,000, and there's lasers that cost $5,000. I have a bunch of those. But yes, it is becoming more popular, but still a large percent do not have lasers. And as far as the minimally invasive dentistry, there's still an enormous amount of the dental population that still enjoys and feels comfortable doing silver fillings. I choose not to. I think we have better choices. And so you have all different levels of care, just like you would probably in medicine as well and other health professionals.
Yeah, because I haven't heard many dentists, speaking about, let's just say, that particular machine, if you tell me the name again, which detects a cavity before it is a cavity. What was that thing called?
It's called a Diagnodent.
Okay.
Diagnodent.
I mean, I haven't heard many dentists, heavily promoting about it. I haven't, no dentist has put me through it, or maybe I didn't know that they put me through it. Maybe I would not know, or would I know if somebody put me through that?
You would know because it's a box that has an actual LED reading, and both of my hygienists here every day have their own. They use it on the teeth, and they get certain readings, and if it gets to a certain height, it says, ouch, there's something going on in there. And the patient has no idea. And many times, I cannot tell that there's a cavity there. But when I start to do the minimally invasive procedure, and I go in and I clean out that little spot where the Diagnodent says there's something going on, every single time there is some decay there that was starting to brew that I'd left or missed years ago. Not anymore.
Well, it gives the meaning of preventive a whole different meaning, I guess.
Yes, it does. It really does. I feel very good about using these kind of devices for the patients. They love it. It's painless, and we can catch things, like I said, before you can feel it or see it even on an X-ray.
Well, when I was 8 years old, my dentist, who was also my MD, small town in Austria, he turned his little mirror, that little mouth mirror, and It has a big metal, stick, and he turned it around. And he hit every one of my teeth to find out whether something is wrong. And when you jumped,
you didn't like that, did you?
No,
I didn't like that idea.
When you jumped up the ceiling, he knew something was wrong.
But now you don't even do that. You use the Diagnodent because that can tell you even before your instrument's going to get stuck in your tooth.
Right, absolutely. So, well, wonderful, absolutely great. Thank you very much, Dr. Piskin.
You're welcome.